Good afternoon, everyone. It's Chelsea Whittington of CWIT PR, and this is a special edition of Your Health Matters, which is traditionally hosted by Dr. Janet Seabrook. Hello, Dr. Seabrook.
Hi, Chelsea.
I am here because we're doing a special live conversation. We had a show all planned out for us to go shopping, healthy shopping, and then a live demonstration, which we're still going to do. But in light of what has happened in Northwest Indiana on August 11th, we both thought it important to have a conversation around the aftermath of the storm and the potential impact on our health, both physical and mental. And before we get into that conversation, can you just please give me a status update on you, your family, and if everything's going okay as a result of the storm with you?
So I still have some family members without power. A couple of them have chronic illnesses. One had to be hospitalized, but so far my family members are all safe, and we're just waiting for the electricity, not the power, because we all have power.
Right.
We're waiting for the electricity for those family members to be turned on. So they're all safe and sound. The health center, we did have a few offices that were down and offline, but now we have all of our offices back online with the exception of our Miller location. The electricity is back on, but we're having some network challenges and internet challenges, and hopefully those will be cleared up very soon. But that provider, Dr. Lavelle, our pediatrician, has been seeing patients she will be seeing patients at the Martin Luther King location. She had been seeing patients here at 1021 West 5th Avenue before Martin Luther came on. But Martin Luther's back online, Ophelia Steen and Hammond is back online. 61st Avenue never went out. Never went offline. And so in 1021 West 5th Avenue, we're back full service. So just looking forward to, getting back to some semblance of normalcy, to be able to provide services to our families.
Your families. I immediately thought about you from a health standpoint after the storm, because I know there are people who, I had surgery set. I lost power and I have an oxygen tank. I have to get my medication and the pharmacy's down. Talk about some of the things that you saw and how health is a domino effect.
Yeah, it was a lot of logistical. It was a logistical nightmare actually to just put a pin in it and to give it, notation of what it was, because we had the hospitals were down, and then when they were back online, they had the physical challenges of people who were coming that did not have oxygen tanks or the ability to run their respiratory machines and things at home. So it was very challenging, but I like to say that entities like the Red Cross and the Salvation Army, those locations were really very helpful to patients who were in need, that did need a place to stay. I worked with, one of the leaders in the Red Cross to put some connections together to get hospital beds for those patients that weren't able to take their hospital beds with them when they, moved into the Red Cross. So just logistical challenges that you don't think about. The pharmacies that were offline, that were closed, you have to think about, well, how can we get these prescriptions maybe transferred to another pharmacy that is open? Can they be mailed? So there were a lot of logistical challenges, but we, as a community, I think everybody just pulled together and we worked our way through it.
Yeah, and that's why I love that your facility starts with the word community health net. And I saw where your organization has been out at various events. So you're doing that anyway in the summertime as school starts and getting the information out to families about physicals and getting those dental exams and things like that. But how has CHN continued to insert itself since the aftermath?
Just since our doors have been open, doing outreach directly to our patients that maybe missed their appointments because we didn't have electricity. reaching out to those patients to help them reschedule appointments, making sure that patients that did have need prescriptions called in, and we were able to catch up with those, reschedule, laboratory services, x-rays, ultrasounds, and things like that to coordinate those services, mammograms, with the referral entities that we have sent the patients to.
And then you have the expected moms. Those I know they were like, oh my gosh, I had to check up for the baby. And I say all these things just to remind all of our viewers and all of your followers of the many services that Community Health Net provides throughout the region. And this was impacted throughout the region.
It really was.
Yes.
And I also, I had a couple of conversations where they were online conversations, but where can we go? Dr. Seabrook, who can we call? And one of the places that I was referring was 311, particularly when, early on in the storm, when trees were down and people were impacted with the number of trees that were blocking roads and things like that. But as the conversation progressed, and looking through social media, I saw that Frank Morvan, Congressman Morvan, was giving updates in community and also working with other entities to get people hygiene products and cleaning products and things like that. So we've just had a community coming together, and so the United Way does have those hygiene products and cleaning products available for limited access. So I would advise you, United Way of Northwest Indiana, reaching out to them. Again, 311 if you're still having challenges. Let's not forget about reaching out to our insurance companies. If you've had to stay at a hotel and other things like that, you want to keep all of those receipts if you're going to file a claim. And I know everybody is so much to process at one time, and it's just like when you're eating something like an elephant, you take one bite at a time, small bites at a time, so you can, feel accomplished. Let's not forget about our other resources. First Baptist Church and Tree of Life Church, just this past Saturday, received a World Vision truck. And so they split the things that were inside the truck. So First Baptist got the first load, half of the truck was donated to First Baptist Church, and we had landscapers donating forklifts and things like that to help lift the pallets out of the back of the truck. And then that half, the rest of it went over the Tree of Life. So this Saturday is August 29th.
Yes.
So go on First Baptist Church's website and their Facebook page for more information, but they're getting a whole World Vision truck. The whole load will belong to First Baptist Church, and we're not keeping anything, as Pastor Nicole Gunn said on this past Sunday, on yesterday. She said, we're not keeping anything. It's all for the community. Okay. So go to either our website or First Baptist Church's Facebook page for more information. I believe it's at 11 o'clock, and the church's address is 626 West 21st Avenue. But for more information, you can also call the church at 219-883-3216.
You better rep your church.
219-883-3216.
I love
Call
it.
for more information about their World Vision truck that will be on our church parking lot this Saturday, August 29th.
Well, then you all need to pull up the Community Health Net truck. Look at me, I'm always trying to forge resources, but that is wonderful, and I have seen the faith community really show up in a mighty way. Just the feedings, the charging stations, just opening their doors for people to have a place to go. Because sometimes people are shut in as well. And I wanted to talk to you a little bit about that as well, Dr. Seabrook. I'm starting to see people who their power has come back on. Yes. They're able to return to their homes, and it's like devastation and concern about even entering an environment where you have spoiled food, where they're down power lines. What are some of the things that you suggest? Do we need to wear masks? We need hazmat suits? I mean, it's serious.
So it is serious, and I'm glad that you mentioned that, because you could be walking into an environment that has mold, maybe not on the walls, but possibly in your refrigerator if it's gone stagnant without having electricity. Same with the freezer. So you want to wear gloves, and you also want to put a mask on.
Okay.
And you want to frequently change those gloves too as well, because you don't want to cross-contaminate anything. If you are dealing with food that has not been refrigerated, frozen, or stored in a safe manner, then please toss it out. I know it's hard, but please toss it out. Don't try to eat it. If there is an amount attached to it, an estimate, you still need to keep that if you're going to file for any insurance claims. But let's take our health first. If you're someone that's has respiratory issues, COPD, which is chronic obstructive pulmonary disease, or you have asthma, or any triggers that mold could bring about, then you should really take precaution and maybe even ask someone else to do it. If you are going to file a claim, maybe you should check with the insurance company to see if there are professional cleaners that will be covered by the insurance company. If you've had damage to your roof line, you definitely want to get in touch with the insurance company, because you want to stop those leaks as soon as possible.
Yes, that's great information. But the big elephant in the wall, and I talked to you about this before we were rolling, and it's even personally with me, as I am typically a very happy-go-lucky person, a glass half full lemonade type. Gets on some people's nerves, so what? But this one impacted me more than COVID, and we were out for COVID for an extended amount of time, but I guess I was kind of still working, kind of understood it's a pandemic, these are the things we're supposed to do, social distancing, we kind of had rules, right? This one is just like widespread, people without power and without resources, and they're walking. I've never seen this much traffic on my street of people just like kind of walking aimlessly, like just looking for food. Look, I've never seen anything like that, and it has impacted me mentally. And so it's happening to me. I know it's happening to a lot of other people.
So it's a little bit challenging to compare it to COVID, because yes, we were inside. We had community coming together to deliver food and packages and things to people who were going without, but our electricity was working. Right. So, and we were able to DoorDash and call all these, places were open. Yes. It's just that we had to be precautious. This is like a war zone. It's like PTSD. We have PTSD with COVID, but this is a different type of PTSD, because you're seeing all of this destruction, and it is so widespread, throughout Northwest Indiana, and it's just really having a different impact on a lot of people that COVID really didn't have, because you think about the isolation, the separation, and things like that. We had to do calls by FaceTime. Our elderly family members, maybe we couldn't visit them as much as we used to. I can remember the pictures of people talking to their family members through the window and things like that, or either the newborn baby and the parents are out on the porch and the grandparents are in the front door, kind of waving and blowing kisses, but you really couldn't, really have any contact. This is a little different, because we can sit next to each other, we can have these conversations, but it's just a total devastation. That when you look at it, it's like, how do you get back to square one? If your refrigerator's moldy, your freezer's empty, you don't know, where your next day's meal is going to come from, if you have a hole in your roof, if you're still without electricity.
And there are many.
And school had been delayed. There are so many things that we plan. This is what we planned for. This is the first day of school. And then that doesn't happen. And then your job is without power. Electricity. And so you have all of these things. Gas is expensive. But then I need gas for not only my car, but for the generator if I have
to get
one.
to.
And it's just this myriad of things to process all at one time, and then to turn around at 6 or 7 o'clock at night, be in the dark.
And so that's why I was waiting for this conversation. What do we do, Doc?
So there are a lot of things available now that weren't that really came about because of COVID. Because remember, we had online and we had virtual office visits. And you had a lot more people reaching out to partake in behavioral health and therapy, online therapy. Just having someone else talk to
Yes.
share what you're going through
Mhm.
versus, you know, the same people that you talk to in your
All
household.
the time, right?
And
right.
sometimes the therapist will have a view that is outside of, you know, your inward thinking and what other
Right.
people around you kind of have the shared kind of thinking,
Yes.
or may not feel comfortable enough to give you the
The
feedback
real,
that you need.
the feedback. That's right.
And
That's
so
right.
I think, but everybody has to process it differently. But I think that we need to make people aware of all the resources that are available. 988 if you're feeling, you know, suicidal, and then reaching out to our various mental health resources that we do have in the community. And if you feel like, well, you know, I really don't want to physically go someplace,
Mhm.
and if you don't feel comfortable doing it locally, then maybe you could look at some online resources.
Telehealth and
Mhm.
things like that. Now, does Community Health Net have some mental behavior services we could offer?
Well, since
or refer?
2010, our health center has integrated behavioral health into the medical visit. And so we're able to take care of adolescents from 12 years old all the way up to
that's
geriatric
wonderful.
ages as far as our behavioral health. And then we also, this is our second year, we partnered with regional mental health.
Mhm.
They have regional health centers. They have started a residency program. It's about 2 years old, 3 years old now. So we have psychiatrists that are doing their clinical rotations.
Wow.
So this is not first year; these are second year psychiatric residents who are going to be, you know, graduating after their third year.
Yeah.
So they're right in the middle of their training, and they're doing their training at Community Health Net in
I
our
love it.
Hammond office, and this is year 2.
Now that's a story. Look at me now. I'm back to PR focus, Chelsea. But that's great to know. I'd love to chat with some of them, and I think that we're saying and having a conversation that a lot of people are thinking.
Yes.
Dr. Seabrook, I'm thinking like not me, you know, but I have these bouts every now and again throughout the day where I just get sad.
Mm-hmm.
I think about my city and how much I love it. I think about my family and how much I love them. But we're all going through the same thing. So it's like you said, we're of like mind. So we're just preaching to the choir, if you will. And people have really gotten a little antsy. You
Yes.
know, I was afraid in the gas line. You know, I had gotten gas and I was just trying to get some ice and people thought I was cutting and I was like, I'm getting ice. You know, people are really in a mental state that I just have never seen before.
I think that as much as we can, and the resources that are available, we need to just wrap those services around individuals so that they know that they're not alone,
Okay.
and that there are things out there available. And if I could, I'd like to share a phone number. I had to write it down because
Please.
I can't memorize every phone
And
number.
we'll put it in the comments too.
It's 219-795-1844. 219-795-1844. And I would imagine that Congressman Mervan would not get upset with me by giving out his number, because this was a public number he put out himself, and I
Okay.
just wrote it down.
Mhm.
But he wants, his office will help give you the information about federal resources that are available for the state of Indiana.
Okay.
Because we've heard a lot about, you know, what the state has been doing, the governor coming to visit,
Yes.
the state of emergency, and
Mhm.
soon, you know, FEMA
FEMA.
coming and things like that. So I want to make sure that state and federal information is available. So for federal resources, you can call Congressman Mervan's office at 219-795-1844, and his office staff will make you aware of the things that are available. And this is where I got the information about the United Way, having those cleaning products and hygiene kits available on a limited basis for people who needed those. And just the last Friday, Indiana Hemophilia out of Indianapolis, they do a
Your
monthly,
friends?
they do a monthly clinic here at Community Health Net, because, you know, years ago they were located down the street on Fifth Avenue.
Yes.
And that office closed, and I was really perturbed.
I
Because
love that
I
organization, and we have widespread situations when it comes to sickle cell anemia.
I was not happy when that office closed down. And so I did everything in my power, talked probably so people were tired of hearing me and talking their ears off about this Gary being a place that needed to have the sickle cell. So of course, when they came back and they said, we need a place, I said, guess what? We have the place for you. So they run their monthly sickle cell clinic here. But one of our other community rooms that we have on this floor, they came loaded down with cleaning supplies, diapers, mops, brooms, you name it, they had it. And it was because the families from Gary were reaching out to their doctors in Indianapolis. They drive up once a month.
And so they said, we can bring it up.
We'll caravan it up here. And that's what they did.
That is awesome.
And so that was just last Friday. So they have a clinic here once a month on Fridays. And it's just a joy to see that parents, that children and their families don't have to get on the highway to drive down to Indianapolis to see them. The doctors come to them.
They come right here to Community Health Net. So as we get ready to wrap up, Doc, for someone who sees this or is watching now, who is in search of a healthcare provider, who's looking for a great place like Community Health Net, where you have trusted medical professionals with a variety of services, what do they need to do to get all signed up?
Okay, so you can call 219-880-1190, 219-880-1190. You can also go to our website, chn-indiana, spelled all the way out, .org. And I want to share that we have family medicine services, pediatric, OB, behavioral health, dentistry, and we're bringing back chiropractic.
Bring it back. Crack the back, Doc.
Yes, we're so excited. I just got off the phone earlier today talking to a chiropractic doctor. He is a private chiropractic doctor, but he wants to serve the Gary area. So he's going to be at our Martin Luther King location.
I love it.
And we're just excited. We're looking at sometime in October, and as we get closer to the date, we will open up his schedule and we'll make everybody aware. We'll start to get back on track with chiropractic care. We'll also reach out to our patients that were coming here in the past last year.
So they can come on back.
Come on back.
But speaking of getting close to the date, what is happening with my mind? I got to spend a little time talking about our breast cancer walk.
Oh, so let's not forget about that. That's Saturday, September 26th. 9 a.m. registration, 10 a.m. is the walk. And while you're there, when you get there at 9, we have plenty of vendors. There's music, there's coffee, donuts. And
we don't need the donuts, carrots.
Other snacks to enjoy. We do some warm-up exercises, and right at 10 o'clock, the walk starts. It's a 5K walk. That's 3.2 miles for those of you who aren't aware. But come on out, 9 a.m. registration. The walk starts at 10. That's Saturday, September 26th. All the funds that are raised are utilized to help men and women who are uninsured or underinsured get mammograms and get those screenings for breast cancer. So.
All right. Well, I'm looking forward to that as well. I'm in training. I'm going to see if I'm going to run it or I'm going to walk it down.
All right,
but either way, we will be there. You are all caught up with Dr. Janice Seabrook, who is also the health commissioner of this amazing city of Gary. So she's just keeping us informed with so much information. And I just thank you. I feel like I had my own personal session with you, even though you all got to watch it. She talked me off a ledge, everybody. We're going to be okay.
We're going to be okay. Gary's strong.
That's right.
Gary is resilient, as my pastor said yesterday. She said Gary is resilient. My pastor, Pastor Nicole Guns, is from Virginia. Okay? Right. And she said, Derek Cole, she had us cracking up yesterday, but the thing that she said that really got us, she said GI.
She's learning that? Okay, she's
said
official
GI
now.
Strong. She is official.
Yes. But I have to reach out to her again. She's a friend of mine, and I know she's wondering. She's like, I've come here, there's snowstorms, you all have tornadoes. I mean, God, have I made the right choice? But indeed she has.
Yes,
for such a time as this. You are invited to head over to chn-indiana.org to learn about all of the wonderful services offered by Dr. Seabrook and her incredible team. I'm so humbled to be able to have this conversation with you, and we just ask that you share this video. And of course, the name of the show, Dr. Seabrook, is
Your Health Matters.
We'll see you next time.